Moving a step ahead, we come to the second topic of the day, communication skills. We've always heard communication is key. In life, in relationships, in work, and in every other aspect of life, communication is as important to ensure success. Communication has the power to make or break a deal. On this topic, I would now like to welcome Dr. Elsa Sanatombi Devi to today's seminar. She is a woman of high caliber and is one who has achieved several accolades to her profession. Dr. Elsa Sanatombi Devi is a FIMA Fellow Scholar. Her research interest areas include collaborative dementia with collaboration with the University of West Scotland, UK, health promotion for elderly, diabetic self-care management, women health issues, and cardiovascular research. She is currently serving as the professor and QMR at Manipal College of Nursing. She's also a faculty at MAHE FIMA International Institute, Manipal. Dr. Elsa has also coordinated the first IELTS, that is the Global Training and Education Center in India, in collaboration with NHS UK. She's a fellow observer under USIEF grant for the 21st Century Initiatives to MGH, Boston, USA. She has also taken keen interest in advanced geriatric workshop for nurses at the Al Salama Hospital, Kuwait. She's a woman of power, and we are grateful to have her amongst us today. I welcome you, ma'am.
Thank you very much, Deepisa.
Thank you, ma'am.
Can I just share my screen?
Yes, ma'am. Ma'am, I will introduce your panel member for you.
Yes, Deepisa.
The panel member for this session is Dr. Seema Deshmukh. Dr. Seema Deshmukh is a researcher, a clinician, and a thorough academician. She has graduated from JSS Dental College, Mysore, and completed her post-graduation in pediatric dentistry for the same. With an inclination in the research field, she has completed her PhD from JSS Academy of Higher Education, Mysore. As a member secretary of Dental Education Unit, she has been actively contributing towards the enhancement and refinement skills in dental education. She is also an active member of the Special Interest Group. Craniofacial biology and rehabilitation of cleft lip and palate are her areas of interest. I welcome Dr. Seema Deshmukh to today's webinar. I now request Dr. Elsa to take over.
Can you see my slides?
Yes, ma'am.
Thank you so much, Dr. Deepasa, for the beautiful introduction. At the outset, I would like to congratulate JSS and the team of organizers for these wonderful webinars, which is of enormous amount of importance for today's scenario in the healthcare section. So today, I would like to also appreciate my FEMA director, Dr. Siraj, and Dr. Joan Gilbert for mentoring me in this area of communication skills. And also, I thank Bhagya for the beautiful invitation to enter into this such type of webinar for JSS. So today, I would like to enhance a little bit of emphasis on the communication skills in healthcare. Though the topic given to me is communication skills, but since we are all from health sciences, I think we ought to understand how we communicate effectively with our team members. So my intentions are to see what are the complexities in healthcare communication, various types of communication, levels of communication, their barriers and solutions, and also good side of effective communication as well as bad significance of poor communication, and understanding human relations using transactional analysis. I think this is the basis for all of us to understand how we act and how we deal with people in a working environment. So few life positions that are necessary to maintain a good IPR in our workplace, and also role playing and competencies for healthcare communication. Healthcare communication is never a part of the syllabus in any of the undergraduate or postgrad program. I think, but this is one thing which is left out, and we need to pay more importance because this is the basis for all success in healthcare. Closed loop communication for healthcare professionals, and here I would like to emphasize on the just 1 minute. I'll just. Okay. Now, we always talk about clinical proficiencies and also language competencies. Yesterday, someone from the among the participants have rightly mentioned what are the language competencies, and today I'll be answering in one of my slides today. So, clinical proficiency. Here we talk about. I'll share my experiences for which it will help us to understand basically. Now, I was a second-year nursing student when I was posted in the OPD. So. A patient has come and then the doctor has seen him. So I have taken complete history of the patient, why he has melena and things like that. And then the doctor prescribed him to do a stool examination and gave a slip for him to go and give the sample. So he just said, go to the billing counter, but he hasn't explained what he has to do and where to collect his specimen bottle and things like that. So he went, paid the bill and went home. So this patient came back the next day. I know it is in a rural place, and the village people, especially the tribal people, are very humble and simple, and they use a lot of leaves to wrap something. And when they come to physicians or PD, sometimes they bring fruits, flowers, or anything that they grow in their garden, they bring. This was a culture of appreciating their physician. So this man has nicely wrapped and brought with banana leaf, nicely tied up, and said in the morning, can I leave this for the doctor? Okay, then the doctor by then entered and said, you leave it there at the end of the table. So he left it there. So before this physician left home, he opened up the banana leaf and saw one Horlicks bottle full of stool for the sample. So in fact, one problem, a miscommunication which we had is we have not explained to him where to take the specimen bottle, how much to take, how to take, and where to bring and keep it. So these are some chaos in the clinical scenarios which we've seen. Another experience I had was an old lady, a 65-year-old woman who came to the OBG OPD with severe back pain. And she also had some gynecological complaints with CK. So she was with an X-ray. So I was just lifting up the X-ray and I was looking at, I was seeing something like a kite in the spine. So with my own observation as a student who doesn't know what is X-ray and CT scan, still I looked at it and I could see something very visible. So when the OB-GYN professor came, I asked, ma'am, you see, look at her X-ray, it's looking like a kite in the spine. Then she looked at very carefully and further investigation was done. And then we started collecting deeper history into that. So we asked, the professor asked the patient, have you ever used copper tea? He said, yes, 30 years back, I used copper tea. Then she asked, when did you remove it? He said, I don't remember. So what happens in this communication process is, this history of having inserted copper tea was not told to the patient when to come back, when to follow, when to remove, and things like that. So it has pierced through and through the uterus, and it has gone towards the spine area, and for which the patient was suffering from back pain for a long time. So I think there is some gap in our teaching and also follow up for what we have done to our patients. These are lay people, very innocent people for whom we need to take care of their entire healthcare system. So yesterday, somebody said very clearly, language competency, what local language, how to use them. So just look at the grammar here. Let's eat grandma. It sounds okay to all of us, but the actual meaning is you're going to eat your grandma, right? Now, if you just put one comma and one cap in grandma, is save your grandma actually from eating your grandma. So let's eat grandma. Okay, so that means, okay, let us have our meal, grandma. Okay, addressing to your grandma. So little bit of this punctuation also is important in our day-to-day language that we speak, which will be a written language and also a spoken language. So we have punctuation in English. We seem to have studied our grammar and things like that in our school young days, but we can manage to forget it even if you become professor or which level faculty. The previous speaker was mentioning very clearly how to address, how to be competent. Yesterday, speakers have emphasized on how to be competent. So competency in a language, whether it is spoken language or written language, it has to be correct. So appropriate use of where the full stop should be kept, comma, colon, semicolon, exclamation marks, mark, apostrophe, ellipsis mark. All these are important for us to understand when we write scientifically or when you want to write a letter friend, or whether you want to write a corresponding letter to someone, or writing a love letter, or writing whatever, okay, in professional boundary that we have. So I think understanding English is not our mother tongue, but since universally it is accepted, we ought to understand punctuations. Now, concerns in the communication process. The entire process of communication is the message that is being sent by the sender to the receiver through various modes, using various verbal, non-verbal, or that the messages that are being transmitted to the receiver and the receiver giving a feedback. The problem lies here most of the time with the feedback. Sometimes the message sent by the sender with his kind of mentality he sends, we do not know how the receiver is receiving, and what the receiver has told the other person, we have no idea unless there is a feedback direct to the message sender to say whether what he or she has understood is what he has said. So this kind of conversation between and gaps in between this feedback is a thing that is playing a havoc in our communication process in our workplace. Yesterday, our speaker has one of the participants has rightly mentioned local language. Local language is very important. I don't think anybody put local language into a professional career in the first year itself. In nursing, we do have 30 hours of spoken Kannada language for the newcomers, so that at least when they go to the clinical, they learn at least how to speak basic things and ask what is required of the patient. So local languages plays a very important role here. So I'll just tell you my experience when I was a second year and taking care of pediatric patients. So we are supposed to give one health education as an assignment. So nursing people are very scrupulous about giving health education. So I had all the mothers of my patients, toddlers, sitting along with their kid on their lap, and my teacher was sitting with them. So she's going to evaluate how I am going to give health education. So it's a local language in that place. It's not my language. It is a Khasi language, which is spoken in Meghalaya. So I prepared thoroughly, and then I had to by heart everything. But sometimes our language, the word used are very close by. So SNI means day, SNEM means year. So I have taken up a topic on oral health for toddlers. So then I started introducing the topic, and I said the first sentence is that the children should brush their teeth twice in a day. So the word said in the local language is Sudyati Binyat Arsinsis Ni means brush your teeth twice a day. So name is very close by. Instead of saying Sni, I said Sudyati Binyat Arsinsis means brush your teeth twice a year. Then my teacher got up from her seat and said, no, Elsa, that's not done. Wait, just hold on for a moment, and then she had to clarify. Still, I didn't realize that I have made a mistake. But this thing counts because the local dialect, the present tense, past tense, plural, singular, year, and the word which is used is very important for us when you want to impact. Otherwise these mothers would have gone saying they brush twice a year, and they would have brushed their kids' teeth only twice a year. Very important for us to learn as beginners the correct way, because India speaks too many languages, and wherever we work as a healthcare professional, the local language has to be given emphasis. So I'll give you my experience of learning Kannada. For first time when I came in 99 to Manipal, we had my first posting was in the community. It was very exciting because it was mango season. Around this time we had posting. We were so excited with a new place, a new people, new environment, and I had 3 classmates who are localized. So they actually were all the time trying to play with me and fool around because I don't know the language. So they all told me to learn one beautiful sentence in Kannada. So that they said, if you see a beautiful woman in their reproductive age, you tell them Akka Maduve Aita. If she says Illa, you ask Istu Makalu. So I by hearted, if Maduve Aita Istu Makalu, if she says Illa, then he said, I by hearted the whole thing. Next day I ran actually to tell a woman nearby. We were given 3 houses. So they pulled my Vasuni from back and said, Elsa, don't tell that. If you tell that, you will get a slap on your face. So this is sometimes it's fun, but my local friends helped me learn the language, and communicating live in the community made me actually learn Kannada. Although those days we never had even a common learning platform in the classroom. So the word communication is derived from the Latin word communicare, means the simple meaning is to share. Okay? Share in whatever platform we are put into. So communication is the capability of forming and sending a message so that another can receive and interpret its true meaning, which is an essential component of leadership or management process. Problem in communication is sometimes we truly don't convey the same with the same intention which the messenger has given us, the person who has given us. So this misinterpretation is a problem that exists in all our levels of communication. There are basically 4 types of communication if you look at: verbal, non-verbal, written, and visual, which I have already explained written. Now, verbal communication is like yesterday our speakers have spoken about how to be very confident in the way you speak. You learning how to be active listener, and also avoid filler words like and then. Sometimes we used to count, and then when teacher takes a class, we used to write how many and then how many hours. We used to do that. So in the Toastmaster clubs, it is very important to count how many filler words you use so that we reduce it. Okay, so we need to also see that good words are used in English. and not repetitively using a particular word, but alternative words, okay, synonyms to be used, beautiful words to be used appropriately for the sentence that we are using it. And also our non-verbal cues, noticing how emotional you, how you show your emotions during a conversation. Some people start crying, some people hearing that your boss has called you, they start weeping. Okay, so we need to understand our intentions for the non-verbal cues that we display during our communication process. Written, I have already explained to you, it has to be very simple. Okay, don't rely on the tone that you use. Sometimes the translator in the computer nowadays, if you do not pronounce it properly, they translate something else. The other day, instead of drug, they translate truck. So if you just misspell it, mispronounce it, then it becomes a different meaning altogether. So taking time to review what you write is important. If you want to send a letter to your boss or you want to send to your director, definitely you have to read 10 times and see whether commas are okay, whether the spellings are right. Nowadays, WhatsApp messages, spelling typo, typical errors are seen. All spelling errors, sometimes it's because computer itself sometimes types for you. If you don't look at it, meaning could be very disastrous, right? And also visual. So when you have a presentation, for example, you need to actually confirm with one expert or somebody to see whether the visuals are okay. Yesterday, I was just trying to put a figure of non-verbal cues. Like, if you watch the Three Idiots movie, the professor in the movie, his facial expression was very interesting. But I removed it because tomorrow they can show you anytime if there is no authenticity and legal liabilities can creep in if you put somebody's picture, known person, a celebrity, and then put there and put for certain things which is not wanted. So we need to consider also the legal aspects. Consider the audience to whom you are going to show. Only use visuals if they add value to what your presentation is all about. Okay, so that it is easy for people to understand. So some of the non-verbal communication that can be affected by our physical appearance, the way you utter the word, your facial expressions, body posture, and also body movement. If the teacher moves up and to and fro on the platform, on the classroom, we get irritated, like you have to keep looking from to and fro. It is quite disturbing. Body postures, if you are like shrugging your shoulder, or if you are leaning on the chair, table, wall, everything, it may not impress the audience. Okay, so we need to keep this in mind because these are some of the things that can be affected in your process of communication. So our non-verbal cues are much perceived very amicably by the audience. So we need to be we need to be very careful about, because they speak much more than what you utter in your mouth. So verbal communication that can also be affected by the tone and the pitch of voice. What inflation that is in Hindi we say put masala. So if somebody says something and you add masala, and it's like telling stories to your children or grandchildren, right? Okay, to put masala into what inflations. These are modification in professional communication. This need to be taken care, because you can't modify and tell. But you have to be to the crispy point. You need to come to the point and say that my professor told me to convey you this. Okay, as it is said, if it is said, it will not have confusions. So psychological and physical state of mind, if the person is really sick or the patient is demented, then we need to consider the psychological and physical state for which the communication can be affected. Past experiences and cultural factors. This is becoming a big problem in our in the entire is globally, because see, in India, if you look at, we are culturally very diverse. So wherever you work, you have to think of what happens to the cultural factors or the acceptable factors for that particular community. So I just have a video, if you could watch. So the video itself is very self-explanatory to see how the interactions when patient is psychologically and in her physical state of mind, and the nurse trying to convince her. But our own views, our own approach has to be taken care of very critically at this point of time when patients become aggressive. So some consequences of bad communication is that sometimes you think you have less friends, nobody likes you, less popular among your friends, and also you feel you're left out sometimes because you don't communicate in the same wavelength of your friends and things like that. So these are some of the consequences, and harder to get a job if you don't know how to communicate. If you are very skillful in your communication, I think you are done with it, because the most successful people in this world, if you look at, they are very good communicators. If you know how to communicate well for the appropriate for the situation, I think you are done with it, and then you will be placed very well, of course, with your advancement in your academics. Additional to that, having a good communications skills, I think your job is done. So people not wanting you to be part of the group is also because we do not communicate well. Sometimes people message you after a year and start say hello, hi, and because you need something from them. But you're totally silent for the last 1 year. So we should not be very mean, and we should not be also very opportunistic oriented when we have friends and the colleagues. We need to say hello, hi, at least wish them on their birthdays or anniversaries, and we need to maintain the relation, which is important. You may not send every day and sit on your chatting time all the time. No, but appropriately, if you maintain your relationship, one day or the other, when you need help, it will be always a mutual help that you receive from your friends or colleagues. Today, now children are waiting when they will go back to the class and enjoy the beautiful scene of teacher-student interactions, lovely interactions. But today, our children are all inside almost 24 hours on their laptop or mobile on online class. All of your faculty, and all of you are clinicians or faculty, you know how your students are going through, how you are going through. So we need to understand these challenges also. So we need to reflect and see adaptability of faculty, adaptability of students, what kind of self-motivation at this point of time. Dr. Chandrasekhar has rightly spoken on how to maintain your time, and a participant has asked how do you maintain the time during this pandemic. It's quite terrible for us to manage, but keeping your space of interest, enthusiasm, I think you can always time out and make your time schedule, and then it's always easier to interact. So have time for family, have time for loved one, have time for kids, have time for your classes. Everything needs to be timed. So our attitude makes a difference. And learners engagement, how meaningfully are learners engaged? And also collaboratively, how are we learning? How are the students learning? So we can have breakup rooms and then they can go discuss and come back. But question comes when it comes to competencies. If you want to give injection, of course, you have to learn how to give IM, intradermal, IV, everything. But it's very difficult to learn on a dummy because in the home, dummy means it is not a skills lab that you are going to get at this point of time. So today, the graduates, especially the postgraduates who are coming out in 2021, okay, they have a lot of issues. I asked one of the postgraduates who is studying for his ENT, my friend's son. I said, how are you learning your specialization? He says, no, nowadays, no specialization. We are only in the COVID ICU. So we are learning Corona, he says. Okay, yeah, fun, but, we need to understand. So what is that administrative responsibilities we are looking at so that the students are well communicated to how they are going to learn their specialty. This is important because super specialty when you learn, I think we need to give time. But today in the pandemic, we all are immersed inside the pandemic and trying to do something to save people on this planet. So I think these challenges need to be reflected. So why we communicate? There are very 6 important things that we need to know. One is to express our emotion. So you always share your, sad feelings sometime to the friend whom you can put your head on their shoulder, right? To promote understanding, to get things done, to pass on and get information, to reach a decision, and also to develop relationships with we have relationships which are very, very professional. So when we talk about healthcare, it is a professional relationship they will maintain so that we are able to give quality education to our students as well as quality care to our patients. Because for us a faculty, students are primary customer in the institute, but when you go back to the hospital, patients are primary customers. So IT is the student, teachers are patients. So it has to be well taught and well understood within this. So we need to communicate for these 6 very important reasons. So effective communication, if you want to sum up, it is like, as I have already mentioned the previous slide, knowing how to written communication plays very important because you write a lot of prescription and patient record and all. The lawyers today are they are very inquisitive about searching where are the some problem errors, wiped out or writing you put or some spelling. They always try to find, some fault into those. So our written communication, our prescription, whatever we write, what we have done for the patient has to be written very clearly with correct grammar. Nonverbal communication, presentation skills as a faculty, patient education skills and compassion, and also cultural awareness, personal connectedness to your patients, to your colleagues, to your friends circle or whoever is in the team, and also building up trust. So unless you have trust, nothing in these things, nothing mentioned here is going to happen. So developing trust within the team member is very important. If you don't trust your fellows, if you don't trust your members, nothing is going to work out. And we talk about transparency, we talk about integrity, loyalty. Nothing is going to happen unless you build a trust among the team members. So and a beautiful verbal communication skills that you develop. And of course, having active listening, because sometimes we tend to react all the time, trying to answer back all the time. So we need to listen to what people say so that we are able to digest all, screen through, and then see what is the solution to be taken. I'll just take you a cultural awareness. I'll take one point on this, my personal experience in the neuro ICU. As a postgraduate, I was post in neuro ICU. We had a RTA patient, very serious, and when he came to the ICU, in half an hour, he expired. So the in-charge nurse told me, tie the leg. She screamed from the duty room. She said, tie the leg. I was a student, so I was like, what is a tie the leg? I was like shocked hearing tie the leg. Of course, when we give death and dying care is given, we close all the orifices. So we do packing, and then we put even bandage from the chin and then to the head, and even toes to toes we tie up with the bandage, so that patient, once the time lapses, then there will be a lot of stiffness and things like that. So we used to prepare. So I'm born Hindu and I'm Christian, so I'm looking at this person. Then I said, tie the leg. Then the head nurse said, it is the Lingayat patient. So I was not understanding what is Lingayat in Karnataka. So at that moment there was no one to clarify. So she said, tie the leg. So I tied put the toes and both the legs going together. She said, not like that. She said, tie as if the patient is sitting in a squatting position or in a meditation position. Then I was like, but how, if you tie like that, this man is almost 100 kg. So how am I going to fit him into the coffin when you want to put? If you squat and sit, then you will not fit into the coffin, because I'm Christian. So I think from that coffin point of view. So she said, no, tie the leg quickly. So she came and she helped me tie, put the leg in the squatting position. Then afterwards, I went back after the whole process was over, and I asked, why do you tie the leg? She said, among the Lingayats, they need to be, tied up, so that is the position in which they will be managed for their rituals, and the last rites will be done. Then I understood, oh my God, this many scars, creed, and then we have to understand. But that's important. That holds important when you want to communicate and understand what are the ritualistic cultural practices that we have in our country. It's too many, but we need to understand if we have to work in that particular place. So importance of good communication skills to generate trust, which I have mentioned, to prevent legal problems, so that we don't make erroneous spelling, grammar mistakes, so that if you make especially grammatical errors in the medication name and things like that, the lawyers will always find a way to catch for the legal liabilities which we are prone to provide healthcare professional with professional satisfaction. When we communicate well and patient feels good, I think it's very rewarding for us to say the patient has got all right and gone home, and they're so thankful and they're so happy about it. Okay? To bring about changes and promote clients' well-being. Yesterday, Dr. Kishore has spoken very beautifully on well-being. I don't have to repeat her. So when you communicate well, and when you affirm, and when you stand strong and help the patient all through his illness experience, I think they would think, that's why they say doctors are God sometimes, because it's the way we communicate. So all healthcare professionals, irrespective of which profession you fall on to, I think this communication and patient's well-being becomes very important tool for us. So it works as a vehicle for assistance to the patient, maintain and improve contact with others, working relationship, okay, in the group, with the team, and also with the patient, and creates ways to effect change. If you want to have a change, if you have a very good IPR and very good communication skills, the team will be ready to follow you to your instruction and see what is the outcome which you are expecting. That means to say good change for quality. So establish relationship among the healthcare team and promote a continuity of care, so that even if the patient goes home, he'll follow you up, or they can follow up the sub-center wherever they are, but still with a very beautiful written description about the health maintenance and what they need to do. I think this will convey a good message to the other professionals who are practicing at the lower level. So there is something called Egan Solar theory, which feel better factor for oneself and ourselves. So the solar mnemonics which we use, that is, when you talk to a person in the non-verbal communication, we need to face squarely. Okay, that means we need to face the person. Okay, no crossing your arms this way, and leaning back and looking at them. Okay, instead we need to lean little forward to the patient, have a very good eye contact to show that you're attentively listening to them, to whatever they are saying, so that you are looking here and there. Okay, and in a relaxed mode, so that when you have these solar qualities for a non-verbal communication as a skill, I think the patient will be able to tell you everything that they are going through. So when you know the patient well, it is easy for you to treat them, right? And you know what are their concerns. So you'll be able to, depending on the need, whether it is psychological or behavioral or whatever, it is easy to counsel a patient and deal with the patient. So this is the solid theory which speaks about the 5 important points. So what techniques can help healthcare professional? One is active listening. So when somebody is talking, yes, and then no, there are some connectivity which you and actively listen to what they are saying so that the connectivity is not lost. Okay. So sometimes online people keep talking and you mute everything and then you keep doing something. Sometimes you will not be listening. So if you have face to face, if your videos are on, if your the voice are on, and then you, even if it is online, we can be still very interactive. So we need to maintain our skill in that sharing observation. Like this, I usually when patients with diabetes don't comply to their maintaining their sugar level, sometimes I show them, you see, you have an amputated patient. If you don't take care of your leg, the same way you will also lose your leg. So sometimes they get little afraid and they tend to listen to you because they don't want to lose their leg. Who wants to lose a leg or a hand? Because it's quite difficult for survival, isn't it? So sometimes sharing observation helps. Sharing empathy. So I have a fracture. I had a volar fracture, so I had plate. So when patients have plate in their hand, they feel very upset. So I said, see, I also have a plate. So they feel good because I am also okay, normal, looking normal and functioning normal in spite of having a plate in my hand. So these are sharing observation with the patient, makes them feel good. Sharing empathy. Empathy is like putting yourself into the shoe of that person who is suffering, especially with a bad diagnosis. Okay, so how to communicate with them? You need to feel for them. You need to understand how they will feel as an individual. If you put yourself into their shoes, how you would feel. And that's important. It's not sympathy. Okay? Sometimes, oh, Papa. So no Papa here. Okay, we need to feel for the patient. So sharing hope, this is the one thing that gives us to live for the next day, isn't it? So sharing hope, with all the comorbidities also, still we said that we can do, whatever possible we can do. This hope keeps us going. And sharing humor sometimes. So and physicians and the doctors and nurses who have little bit of sense of humor, they can actually attract the patients and they listen to them also. And this sense of humor is important. Otherwise, we'll all have burnout at this point of time. And during this COVID, especially, people have gone crazy and people have gone totally burnout, and a lot of suicidal ideations are on. So I think we need to cheer up and share this if we are a person who is born with a sense of humor. Sharing feelings, especially the loved one. Today, if you look at the COVID ICU, no one can enter. People die and they get buried or cremated even without seeing their loved one. I really don't know what is the post-pandemic health anxiety people are going to face. I think this sharing feelings with the loved ones, even if there are critical restrictions, I think we need to have some media, like now we are able to speak to them on video call and we are able to see them. Sometimes they cannot speak, they cannot see, maybe they are sedated. So these are some things which are very unwanted feelings which the caregivers or the loved ones are feeling at their home when they have their patient in the ICU. That is a beautiful therapy. So nowadays we forget to take care of, we are not touching our patients anymore and taking care of them. Like how we take care of a little baby, we need to take care also of older adults also. Okay, that's therapy plays a lot. Holding their hand, and talking to them and giving them information gives them a very positive, strong sensations to their health compliance. Being silent. So when a person is diagnosed with a very with a very serious disease or a very dreadful disease, talking to them, saying, "Don't worry, no, God will help." Pray. This is not going to work. Sometimes you are just being there, and in silence also help them console. So there are moments when you can't really speak. You have faced with you or with your friends or with your colleagues, you have faced some situation, but being there is important to help them go through their difficult moments in life. So clarifying doubts, whatever patient is asking or student is asking, is good to clarify their doubts. So these are some of the techniques which can help us communicate well with our people whom we deal with, either the students or colleagues or with the patients. So what must we do to convey? Focus on one thing at a time. We don't jumble up into too many ideas and things. Paraphrasing. If they have failed to understand, you can paraphrase once more. You can say once more a whole sentence until they understand. Okay. Tell them one time, two times, three times, four times. There is no harm, provided they don't make errors, especially in the care aspect. Asking relevant questions and also summarizing. This is one thing which is very useful to the patient. Teach back technique. Now, teach back technique is we tell so many things about diabetic patient, do this, eat this medicine, but we do not ask back the patient, what did you understand after having thought? So teach back technique will help you understand what you have said, how much did they digest in understanding it. So your reinforcement for what they don't know is important, so that patient knows completely what to do back at home when they go back with their comorbid conditions, where they have to do take care of their diet for the particular disease, medications, and also exercises, which actually improves their health status when they have a comorbid. So this back technique can help the individual. Self-disclosure, like sometimes saying what you experience also with a similar what patient is experiencing through can have a lot of impact on the person in discussing with you regarding the problems and concerns that they have, and in tackling the concerns. So one is confrontation. Another way to confront the patient and clarify all their doubts so that the patient knows what exactly. Sometimes there are patients who are a little aggressive and who keep asking so many things. Don't feel bad about it, but you need to calm down and then you need to talk to them. So this talking to them, convincing them, is convincing people is one of the biggest challenges the healthcare professional, because people don't seem to have time. But we need to have little time for them and confront, and then you need to clarify all their doubts before they could go home, because today medical shopping is a big trend. So they'll say, this doctor gave this, why you are giving this? There may be so many things. So you need to confront them and then make them understand what is the reality. Okay. So patient education here, we usually do a group role play, but here I'll give you the scenario so that all of us will reflect and learn what is mean by teaching a patient. So Mr. X, 75-year-old, admitted for amputation of his right leg due to diabetic foot. The student need to demonstrate how they will teach this patient, because they have to go home. Patient has amputation, patient has a wound, patient has a cast. Okay, we have to open in between, do the dressing. Patient has to maintain sugar level, also blood sugar to be checked in between. His diet to be maintained. Okay, and also his injection, maybe insulin modulation has to be done. There are so many things this 75-year-old has to think about and look at, and then he'll have also other problems like phantom limb. There are so many things. For losing the leg, psychologically itself the patient will be down. So how are we going to teach this patient? One need to think in logical sequence. Another one is patient counseling. So Mrs. Y is feeling low as he has to undergo second chemotherapy cycle. Waiting at the daycare center for chemotherapy, Mrs. Y was in a pool of tears. Now, how will you counsel this patient? Patient is coming for her second chemo cycle. Okay, it's not a pleasurable thing to say that I'm diagnosed. I don't know how many people would happily say that I'm diagnosed with cancer. It's not. It's like a death sentence to this one person who long to live a better life for years to come, is having a dangerous disease and going through, because we do not know the outcome of the outcome depends on many other factors. So we need to know how to counsel a patient. Today, if you look at caring COVID positive patient in the ICU, there are a lot of experiences which all of you will be facing through. So Mrs. Victoria, 60-year-old, who was in ICU for last 5 days on ventilator, was restless and disoriented at times. Her saturation fluctuates and is on close observation. You can imagine the patient in the ICU. Now, everybody fears to get admitted itself. It's horrifying for people to say that you'll be admitted. Now, people don't die of the COVID. People die of hunger and not having water to drink also. Because nobody is caring for them in many centers. Okay, in a hospital where it is overwhelmed, who is caring about it? There are life experiences of patients going through various problems. Okay, so now as a healthcare professional in charge of the Mrs. Victoria in the ICU, explain how will you console her husband who is anxious and keeps you calling every now and then, how we see. And moreover, we are already sealed up, and then patient can't even know who is the person. Right. So next is discharge planning, how to teach. Okay, Mrs. Basanti, 90-year-old, was treated for severe UTI and is now ready for discharge from the hospital with antibiotics to be continued at home. So you as a physician and a nurse, you're going to send this patient home. Patient is 90-year-old. Now you have to talk to your family member. Family member is the only solution, because this 90-year-old woman is not going to be able to maintain her medication at home, and also her diet, her other care aspects. Okay, so we need to learn what is that ingredient you want to teach. You have to think of the age factor of this person. What are the basic needs of this? There are so many things that you can teach to the caregiver of this particular patient. Now we are going to talk about healthcare professionals. How does collaborative communication, how are, because I can't do everything in that one ICU, right? But we so many healthcare professionals work in ICU, maybe the anesthetists, the physicians, the intensivists, maybe the nurses, maybe physiotherapists, respiratory therapists, maybe the dentistry comes into picture because patient may have their problem. There are so many people that gets involved into the care aspect. So how collaborative communication works? So collaborative communication is nothing but group of people who have open communication, share common thoughts, ideas, beliefs, and working towards a common goal. Now, in the group, in the collaborative communication, it is principle-based process of working together that produces trust, as I mentioned earlier in the slide, of trust, integrity, and breakthrough results by building true consensus. That means just because I'm the boss, I will take the decision. No, we need to have consensus from the group after having to know what is the evidences that we have in taking care of a patient. So with a common goal that the patient will receive the best quality care that is designed through our protocols and procedures and whatever design structures that we have in our workplace. So this is how we need to collaboratively work. So this communication in the team rather is too important for us. Now the evolution behind collaborative communication comes. If you look at healthcare today, we have problem with medication. You just imagine everyone is buying medicine of their own. Now self-medication, over-the-counter drug prescription is too common. People are eating all kinds of antibiotics. We do not know what will happen after the pandemic is over. So if you look at US, which records every error, they said 98,000 deaths per year because of medical error, and it is a leading cause of death. It is next to just sepsis. You can see in US, which is insurance-oriented care facilities available. In India, we all give out-of-pocket. So in this also, they say in the WHO has declared that medication error is top 10 killers in the world. So we need to understand why this is happening is because there is a gap in the communication. In India itself, we see that 5.2 million medical errors are happening. This is some rough calculation, maybe because every hospital doesn't give actual picture of adverse drug events, reactions, and also the drug errors. Nobody gives because so how do you see this healthcare scenario in India in patient safety point of view, especially during this pandemic? How are you looking at, because person is giving medicine, because same person who gives medicine today is not recording, because recording people are different, caring for the patients are different, because you can't open up all your PP and do the recording. So we do not know what is actually practice and what's happening. There is no correlation. You will see in another few months to years, you will see hundreds and thousands of papers coming into some of these communication issues in the ICUs or in the healthcare. So healthcare is very complex. Okay, medicine used to be very simple in the past, very ineffective and relatively safe. Now it is complex, effective, and potentially dangerous also, because unless ethically you are seen by a physician and then it is given with evidence, if it is not given, it also very, very dangerous for us. So I have a little girl, Emily Jerry, was 2 years old when she lost her life after a pharmacy technician filled her intravenous bag with more than 20 times the recommended dose of sodium chloride. You all know when sodium chloride, the bigger amounts are never even infused directly because you have brain damage. All right. So this little girl was lost. This little cute girl. You can imagine if you are the parent of this little cute girl. What went wrong? What went wrong in a communication cycle? You should just see just single medication cycle. If you look at, we need a physician who is prescribing the medicine, the pharmacy who is dispensing, and the nurse is at the end that is giving or administering to the patient's responsibility is the role of the nurse. So if there is little gap in the communication or errors in the written order which is given, you are going to make a mistake. So doctor writes a wrong medicine, wrong medicine will be dispensed. The nurse will also, but they think that the nurse will know everything. The nurse cannot know everything. So there has to be correctness from physician's point of view, pharmacy and nurse. But this counter checking is important in the loop when you want to say that it is error free. Today medication errors are everywhere. This is very serious issue which we are going to face, in the days to come. So say what you mean and mean what you say. Say what you mean means to be truthful in what you say. Means what you say means if you needed be, you will be able to follow through what you said in the first place. Sometimes we tend to tell our children, unless you do this, I will not take you out. Unless you do this, I will not give you food. So we many a times we say that. Okay, sometimes this threatening also is threatening our little ones or threatening our students. Threatening doesn't work at all in our communication skill. So we need to be truthful. We need to be transparent in our communication. We should hold on to what we say, which is important. Okay, that means we need to counter proof. We need to counter check and whether what I'm going to say is correct or not, especially in a community of professionals when we work together. So how does closed loop communication work in healthcare, which is very important, all of us, because without this, I think we will fail in somewhere or the other, and the impact is on the patient and the people who are under your care. So in closed loop, how do you work out this? For example, you're working in the operation theater, and then you have the anesthetists, you have the surgeon, you have the nurses, you have the technicians, and students, including students. So the surgeon shouts out saying that hang another unit of blood because patient's blood loss is more and patient may be having issues. Parameters are going wrong. Okay. So now who is going to hang? Who is supposed to do? The surgeon only said hang another unit of blood. Now we have so many people around that who is going to hang the blood is the confusion, right? But in the closed loop communication, the surgeon would say, Mary, hang another unit of blood, and Mary would reply. What she will reply? Hanging another unit of blood, and then it is done. Okay. So now there are a lot of process when you hang one unit of blood for the patient. There are counter checking, counter signing, everything is done. Okay. That is what the communication loop, the closed loop means. So the sender will call out like what the surgeon has done it. The receiver receives the information, says that I'm doing it. This is checking back, okay? And then checking back through whether second checking is the one that you close the loop. That means you have done perfectly right. This closed loop communication among the care team members is perfectly important because if you do this, errors can be minimized. I'm not saying errors will not happen in emergency, but errors can be minimized if you follow your protocol on your closed loop communication. So simulation holds vital here. So that means the students should be taught on simulation. How to communicate is very important because you need to simulate and make them learn in the simulated scenario so that when they go to the patient, they are equipped to tell them how it is, what it is, and how they should be in the team. Okay? That's what Bhagya has yesterday rightly said. If you want to, there is nothing is going to happen unless you work together with your interprofessional team members because we have thick walls between each other. So if you want good care outcome, positive outcome for the patient, we need to work together for getting, keeping in mind our roles and responsibilities and the ethics between the profession. So effective team prevents communication problems by using closed loop communication, saying what you mean and meaning what you say. So collaborative communications, do we need collaborative communication for quality education and practice? Obviously, yes. Then who should be in the team? Who should be in a team member when you have a patient with dementia? Can anybody unmute and respond to me? Said when you have a patient with dementia, who are your team members? Who could be in your team members to handle a patient with dementia? Take it as an elderly who is 65-year-old. Anybody would like to try from the group? You can unmute and talk. I have been talking because activities are not going on. So anybody would like to unmute and talk on this? Who are the team members could be to effectively manage this elderly with dementia? If not, please put in the chat box. Who all should be there when you have a patient with dementia? A person, for me, there can be a medical person who is going to assess and do the diagnosis. A nurse, maybe a psychiatrist, a psychologist to do counseling, okay, and also maybe social worker because they need to get help into many of the care facilities. You may also have volunteers, NGOs who are helping them. There are so many people in the care of the dementia, and the most of important is a caregiver. So, patient has a dementia, has a problem with the cognitive decline is there. So patient cannot understand. So we have to work on the caregiver. So caregiver here plays a very important role. We cannot remove them from the membership of learning together and for a good practice. Okay, so can you put up in the chat box which all members need to be included in the team. So issues faced in IP communication, collaboration, personal values and expectation each member has in the team, personality differences between the team members, hierarchy, who is the boss, who is the second in line, third in line, and who are the the students and the postgraduates, poor guys. A hierarchy, disruptive behaviors. If one of the member is very disruptive and very aggressive and throws up in the rounds. It's very unfortunate for the team members to lose this collaboration. Culture and ethnicity. So many a times we say who comes from here, we are from northeast, we are from north and south. We do a lot of the distinguish. We distinguish ourselves between the northeast, west, and south, and also the depending on the culture that we share. Okay, and generational differences. 30 years back, if you look at now, the professors will have a different views. Today's generation has different views. A lot of differences between the generation. So a gap exists, which we need to understand. So we need to adapt. Adaptability is important. Gender, historical, interprofessional, and professional rivalries. So between medicine and dental, between nursing and other, there are so many boundaries. So many big walls that we face between the profession. But how do we thin down that? Okay, difference in language and jargon, difference in schedules and professional routines of the various professions. So varying levels of preparation, qualification, and status. So we see super specialty physician. Even among the medicine, you see people who are in cardiothoracic and neurosurgery. They seem to have a much more higher level of skills. Also, there can be barriers between various subspecialties, and also qualification and the status they hold on to. So this can actually negatively impact communication and collaboration among the team members. Differences in requirements, regulations, and norms of professional education, fears of diluted professional identity, differences in accountability, payment, and rewards, and also concerns regarding clinical responsibility they hold on to, and the complexity of care that you fall in the critical care areas. All these issues can be arising in front of us. But how do we communicate properly and then collaborate with the health care member is going to resolve the entire issues, and we'll be able to give a quality care. So emphasis on the rapid decision making. So culture and support of collaborative communication, how to establish them, common purpose and intent. One should have trust between the members, respect and collaboration. And team members value familiarity over the formality that exists in the organization. Recognition and self-awareness, which Dr. Pooja has already spoken yesterday very beautifully. And creating opportunities for different groups to just get together is a highly effective strategy for enhancing collaboration and communication. Encouraging open dialogues and also collaborative rounds. So rounds of all interprofessional team, if they go together, you don't have to, that message will not be diluted. Everyone hear first-hand information and see the patient. So anyone who come back and take the care of the patient, you don't have to be explained by somebody else again and dilute the information. So encouraging open dialogues and collaborative rounds. Developing and implementing a standard set of behavior policies and procedures, which is very, very important. So our policies and standards, standard operating standards should be maintained so that whoever does that work should do as per the protocol. Then there is no confusion between the members. And also, if there are people with disruptive behavior, taking that person into and handling that the individual is important, because one person's disruptive behavior should not disturb the collaborative communication strategies that we adopt in the team among the team members. And also to see that quality care is given, and there can be errors happening any time of the care aspect. So non-punitive environment. But many a times in an Indian scenario, especially if you look at some profession, if you make a small mistake, they make a big issue and then they put you out there, they terminate. There's so many things that do. So that is why people hide it. Even if they make a minor mistake, which can be reported and action can be taken immediately, be punished, so they'll hide. And so what happens is patient will not get the antidote or the remedies, and then they suffer with health and illness. So there are 3 levels of communication. There are so many levels, but I'll just plainly speak on intrapersonal, interpersonal and public. So when we see interpersonal means, suppose if a professor gives you a seminar, tomorrow you are going to talk on this topic. I am sure the student is going to prepare and whole day up and down till night, sleep, no sleep. They'll be preparing how to talk. They'll be talking out to themselves. Sometimes they'll see in the mirror how their presentation skills are, how they look. All that preparation, individual self-preparation is what we talk about interpersonal. Interpersonal between two or more people, and public is when you stand out and speak in common platforms or to a large group of people. So these are the levels of communication. This holds important for us to gain our confidence. We need to prepare, highly prepare, so that we are confident and also we are optimistic about the positive communication. impact on the people. So challenges and some solutions to some of the communication issues are like, sometimes you have a patient who are aged, okay, who have a cognitive decline or disease and disability or environment factors like physical environment. You have 3-4 patients, but you want to ask very sensitive issues, history, you want to elicit from the patient. It becomes very difficult. But if you have a single room or you have an examination room, patients will feel comfortable because their dignity is maintained and also their privacy is maintained. So the physical environment was important for us when you deal with it. Or if you want to counsel a student or a faculty, having a counseling room separately kept is going to make. But if you counsel in front of everybody, that's not going to work out. Social environment, that is who all are there during when you speak or when you counsel up individual. And also the facility culture which is there in the organization. So these are some of the challenges that we see in the environment and how to solve them. When you want to talk, it has to be complete, it has to be very clear, concise, brief, and timely. So no blabbering and no beating around the bush. So address very formally, use polite language, avoid abbreviations, avoid jargon like abbreviations. When you say OD once a day, okay, we all know in healthcare professional. But to another lay people, OD mean overdose. So people can mistake it very, very differently. So there are cases when I ask what happened to the patient, OD. To me as a nursing student, when I knew OD means once a day, okay, medication. So OD can be different to you and to me and to the public. Don't use emotions when you talk about facts and figures and want to communicate strongly. Proofread what you say. So think one more time back and then think and then say the right thing. Okay, so proofreading what you say is important. So I'm bringing you back to transactional analysis very quickly. There's a difference between communication and transactional analysis. Communication is trying to share information between two people. Here, if you see two or more people, transactional analysis is trying to understand in what ego state you belong to, whether you are in a parent state or adult state or child state. This is important if you want to have a very good communication skills. That is why people, when they want to, if the boss calls you in the office, they'll see whether boss is smiling or not. If they are smiling only, you will go inside, right? So you are trying to actually look at in which ego state the boss is in. So these are human interaction analysis which we need to make. So when we talk, because understanding transactional analysis will help you communicate better. Okay, that's why I'm trying to focus on this. So personality ego states are like parent. P stands for parent ego, A stands for adult ego, and C stands for child ego. So parent ego are originated in friends, originally originated in friends. So they are taught concept of like what my mother tells this, my father said like this, don't do this, don't do that. These are all parent ego. So some of us can be in a very parent state all the time advising, but who wants advice now? So we need to think, okay, very clearly into the current scenario. So the next one is adult, that is internalized new learning, which is the thought concept of life. Means we are all adults here in this platform. So we know how to progress. Okay, that is your based on your evidences and how you climb in the hierarchy of success. All these are thought concept of life. And the third one is child ego, that is internally originated influence. That is self concept of life. Means they always live in the present state, there's a felt concept of like, oh wow, so beautiful. Okay, so these are things, but all these ego states are important. Don't we sometimes get stuck to only one and remain there? That's why some people say you're very boring. Okay, so we sometimes, depending on the situation, we are in different state of mind or different ego states. So if you know this ego state, you'll be able to handle the conversation, and the communication skills can be applied very well if you know their state. So sometimes parent ego are very kind of judgmental, parental things. And adult ego is non-emotional. They believe on facts and figures. Creative is child ego is a very creative, curious, inventive, playful, childlike, joking, emotional. These are some of the egos. So if you understand this, it's easy for us to interact. So child ego states when parents speak. If you ask weather today in Manipal, it's heavy rain. It's fully cloudy now. It rained heavily 1 hour back. Okay, so this is how parent to parent. So if too much rain means all the crop will go. So these are some of the transactions that may go on. Other transaction. Now, if I ask you time, I think according to my clock, time is 12:10. Okay. So, and child means having fun together. So many times if you see child interactions, you can see children, they talk, big things. They don't know the value of car. Say that you have a beautiful Audi car. So another child may say, oh, my father has lorry. So lorry is, so to the child, lorry bigger, so maybe more price, but they don't know that Audi is more costly. So these are some of the transactions that you can see child to child. So according to Burnett, there are 4 life situations we need to analyze. So what is most important is I'm okay and you are okay. So when you say I am not okay, you are okay, means I'm wrong, you're right. Second one is I'm not okay, I am not okay, and you are also not okay. It is very difficult to see that situation. I'm okay, I'm right, but you are wrong. So all these three are not going to work. The communications, pure good communication comes only when you are right and also the other person is right. So that means I'm okay and you're okay is on the platform that we need to stand for. So they have very beautiful instructions, analysis given for life position. So when you say I'm not okay and you are okay, means there is a depressive despair in the person. So he needs counseling. So when you say I'm not okay and you are also not okay, these two fellows are not going to look at each other anymore. But when you say I'm okay and you are not okay, means I'm right and you are wrong. This is a very destructive, arrogant position or behavior. So this needs to be solved because this personality is going to disturb in the communication process. So I'm okay, you are okay is a healthy, mature position which we need to face, which we need to have in the group, in the interprofessional team, so that we're able to function together. So there are very beautiful interactions on classifying transactional analysis to complementary, pros and ulterior. Complementary is like, I'll just give you a family example. The husband comes back, after the ICU care in the night, very late. So the wife understands my husband must be very tired. So he asks for a glass of water. So she brings warm water and gives him, though it was late night. The same husband next day has gone out and then come very late. She was waiting for dinner. He has gone and hanged out, and then last he comes, okay, and then he on the dinner table he asks, "Can you pass the salt?" In the cross transaction, you can imagine what the wife is going to answer, because he went and hanged out, and he know the duty, but he has come back late after roaming the whole night. Okay, so the wife gets angry, said, "You should have realized and get it yourself before you sat down. Get yourself." Okay, the same husband has gone to sleep and very upset. He went to sleep. Next day he wants to go for work. So we have something called ulterior transaction, where there are two messages which is conveyed. One is overt or socially accepted message. The other is covert or psychological level message. So what we are going to see in that husband who went to sleep very upset, next day got up still angry with her and says, he was getting ready for the job. He says, "Get me the socks." And he says, "Anyway, you're not a good wife." Now, what will the wife answer to this situation? I am sure it's not going to be a happy moment to say. So he said, "Hey, it's in the drawer. You always tell anyway that way." Okay? These kind of conversations are having two hidden meanings. That is why they are called either ulterior, hidden, or mysterious. So these kind of communications can actually hamper in our day-to-day dealings in the healthcare professional communication span. Okay, so there are for patients to comply, there are two kinds of contamination. So when personally instances interferes with one another, it is known as contamination. I'll just give you an example: contamination prejudice and contamination delusion. Contamination prejudice is you give a patient rifampicin. Okay, patient, this is a first line of treatment for tuberculosis. But we all know in the lay person, any medicine is given after food. But rifampicin is given an empty stomach at 6 a.m. in the morning as per the routine. So this patient, if you give the medicine, he'll keep under the pillow because he will eat only after his breakfast. But we do not explain to him. So there can be contamination. If you ask why you are taking medicine after breakfast, say, "My father told me, my mother told me to eat medicine only after food." Okay? So this kind of contamination can have impact on the compliance of medication. On the other hand is contamination delusions. Okay. So I have a student of mine whose son was in 8th standard, and he stays in the hostel. One night he called the mother and said, "Mama, if you don't buy me a drum set, my fever is not going to." He had a mild fever, and he says, "Unless you buy me one drum set, my fever is not going to come." So fever has nothing to do with drum set. So it's a kind of delusion which we have. So sometimes child, in the next picture, what you see is contamination can be from the parent, contamination can be from the child, and contamination can be both. So this contamination is important for an adult professional like us to handle a patient for compliance. Okay, so this has to be tackled very beautifully. So the 6 success elements in IPR, if you say in a healthcare, among the healthcare professionals, it takes a combination of self-awareness, which yesterday's speaker has very beautifully spoken during the emotional intelligence, self-confidence, positive personal impact, outstanding performance, communication skills, and interpersonal skills. So This holds very important to maintain IPR, okay, analyzing the situation, establishing a realistic objective with time management. The doctor was spoken very beautifully by Dr. Chandrasekhar, selecting appropriate ways of behaving, controlling our own behavior, shaping the other people's behavior, and monitoring our own and others' behavior in the healthcare is important for us to be successful. So the biggest communication problem is we do not listen to understand, we listen to reply. With these few words, I thank the audience and the organizers for the session given to me. I think I have taken only 5 minutes of your time. Thank you.
Thank you, ma'am. You coming on from Nepal and learning a foreign language like Kannada is not an easy task. You are definitely an inspiration to us. I now request our panel member, Dr. Seema Deshmukh, to give her thoughts on the topic.
Yeah. First of all, good afternoon, one and all who are present here for this Professional Excellence Program. I would first like to thank the organizers for giving me an opportunity to be a reflection panelist for such a important topic, that is communication skills, which is very near and dear to me as well. And this was seen very effectively in ma'am's presentation. I would first want to congratulate Dr. Elsa ma'am for effectively communicating to all of us how important effective communication skills are. Ma'am, the best part of your presentation was that there was real life instances, real life practical examples for us to exactly relate to what ma'am is trying to tell. So that is also one of the very important way of communication. And one important thing that I really liked is in this presentation was that communication is definitely not like only broadcasting, that is only sending of information. It also involves a very important aspect, that is active listening. That was what also highlighted by ma'am, that active listening is where the communication actually begins with. I picked up a few keywords from ma'am's presentation, which really I like those keywords really, and which can maybe put the entire presentation to us in a very nice way. These keywords were like listen, connect, relate, identify, empathize, explain, communicate, and then success. So when we have all these things, factors put together, obviously there is going to be success in whatever plan that we are having. So we know that any idea, any thought, any concept will not materialize if we do not have effective communication. Ma'am also brought in certain important aspects of written communication, which is very important for us from a healthcare perspective. So how important written communication is and what can happen if this certain small things are not taken care of. Also, there were certain barriers which are there for communication were also brought in, like it may be cultural background, it may be age, it may be environment. All these factors are going to definitely influence the communication which is happening between two individuals, or a patient and a doctor, or a student and a teacher. So it is first important for us to identify these barriers. Only then we will be able to materialize it properly. Only then we will be able to remove these barriers and bring out effective communication. Ma'am also put in certain important points like collaborative communication and closed loop communication, which is very, very essential in healthcare services. If I have to put things in a nutshell, I can say that I can put up this entire presentation in a way that which reminds me of a small quote which I had read somewhere and which very well I understood, in fact, today. The quote said something like, for an effective communication, it is very essential that first we get into our subject. Subject here is not the content that we are reading. It is the person to whom we are communicating. So first we have to identify the person, identify that person's perspective. Then get the subject into yourself. That is, allow the person to identify your perspective. And then there is no barrier which is going to be there for effective communication. Definitely our communication will be effective. And to put the entire presentation in a small nutshell, a few C's which I picked up from ma'am's presentation itself. We need to be very individual as well. We have to be concise. We have to be concrete, we have to be clear, and then there is going to be a complete and effective communication. Ma'am, thanks a lot for such a lovely way of, and with the ease, bringing out the entire vast concept of communication with such ease. Thank you, ma'am.
Thank you, Dr. Seema. In the question answers, there's a question from Dr. Maurya. Could you please take?
Yes, there are certain questions for Dr. Elsa. The first one is how to communicate with a non-cooperative, indifferent people.
Yeah, we come across a lot of patients who are aggressive. They are aggressive not because they want to be aggressive, maybe because of the deranged chemicals in the body when they come with the health problems to us. Or even if you have a student who is aggressive, there must be some reason behind it. So I need to you think the faculty, the counselor need to sit down with the person, or if it is a physician, you need to sit down with the patient, and you have to be very patient for some time. So you need to know what is going wrong with them first. Shouting at them is not going to help. So I think we have to be with them. Like I said, sometimes silence speaks much more. So being with them, trying to understand how their aggressive behaviors are looking at. If you know their root cause, you act on the root cause. Slowly, you need to make them feel that you are patiently listening to them. Okay? So when they cool down, then you talk. When they are angry, if you talk, they may hit you back. That's why we have physical abuse from the patients, okay? Or from somebody attacking someone. So we need not hit back at the same time, but have patience, wait for a while, and try to make them understand the root cause. When you know the root cause, everything can be solved. Policing is not going to help. Advising is not going to help. But taking through their problem and trying to understand the issue, they need to solve. That is called counseling, because the person needs to bring out what are the possibilities of solving the issue by themselves. But you are only a person who is helping that. Seema, we can't hear you. I can't hear you. Your voice is breaking.
Excuse me, ma'am.
I cannot hear you.
Excuse me, ma'am. Your voice is breaking. The remaining questions will be answered personally via mail. We now come to the end of this session. I thank Dr. Elsa and Dr. Seema for teaching us the right way to communicate and enrich our skills. We kindly request our speaker, Dr. Elsa Sanatombi Devi, to accept the certificate as a token of gratitude.
Thank you so much.
We now call our panel member, Dr. Seema Deshmukh, to accept the certificate as a token of gratitude. Thank you, ma'am.